Other news now, an alarm is being sounded as the deadline nears for healthcare workers to be vaccinated.
It's a community crisis. It's a pending community crisis, nothing short of it.
In 6 days, with rare exception, employees at hospitals and nursing homes who are not vaccinated won't be allowed to go to work.
Some rehabilitation and long-term care facilities are bracing by closing their doors to new patients. 13 Web's Jane Flash tells us why those facilities could face the greatest number of employees who walk off the job.
Well, nursing homes and long-term care facilities have already been stretched by COVID. According to vaccination rates provided by the state, facilities here could lose 2 of every 10 of their employees. Workers outside Strong Memorial Hospital protest the vaccine mandate. In Monroe County, 13% of hospital workers have not been vaccinated. That number jumps to 22% at the county's skilled nursing facilities. Unless that changes significantly over the next 6 days, it means those facilities will have to get by without 2 of every 10 employees. Anne-Marie Cook is with Lifespan.
There are some individuals who need nursing home care, who need long-term care. And if long-term care providers can't admit people because they have serious workforce shortages, then I don't know how we will provide care.
Long-term care facilities have been stretched throughout the pandemic. Lifespan says leading up to this mandate, families already had fewer choices.
When that list keeps dwindling and when you have families who are really trying to make the best decisions for their loved one, and they're told the only bed availability is out of county.
A nursing home trade group says 60% of the state's nursing facilities are now closing their doors to new patients.
It was a crisis prior to the onset of the COVID-19 pandemic in 2019. With the onset of the pandemic, we've seen our employment levels drop.
Ultimately, staffing shortages at these long-term care and rehab facilities circle back to hospitals.
If there can't be admissions to long-term care, if folks coming out of the hospital can't get into rehab and receive the care they need, we have a community crisis on our hands. We don't have a lot of hospital capacity here, so we'll end up seeing a backup in the hospitals.
Now, that nursing home trade group has asked the governor to allow healthcare workers the same option given to teachers to work unvaccinated as long as they are tested for COVID. The state has said testing workers before every shift is just not practical, and so far there is no movement away from that stance.
At schools, scrambling to put together COVID-19 testing plans for unvaccinated staff and students. This per the governor's mandate. And as Jane Chaco discovered, the demand for testing supplies is very high.
Yeah, Don, local health departments are ordering thousands of rapid tests so school districts can meet the state's requirements. The governor's testing requirement comes as more people are getting tested for COVID, limiting the supply. State guidance says testing must be done weekly for unvaccinated staff. For student testing, the guidance is unclear as to how many students will need to be tested and how often. Ontario County Health Director Mary Beer says schools have enough rapid tests for now, but could need more later.
We're not quite up and running, but we're really close. We're hoping within a week or two we will be up and running in all the schools.
Ontario County schools will use pool testing for students and unvaccinated staff. Rapid tests will be reserved for individuals who were exposed to COVID or are symptomatic.
The state was a little late, but it is what it is. This is an evolving pandemic.
According to state data, more people are getting tested for COVID now compared to this summer. Binex Now, an over-the-counter rapid test, is out of stock. A spokesperson for the medical device company Abbott says they ramped up millions of tests that will soon deliver. And Livingston County Health Director Jennifer Rodriguez says schools will have this rapid test available. They're waiting on more tests to arrive.
We are able to have some level of supply, but certainly we want to get more. We put an order in a few weeks ago. We did get more test kits today. So I think it's slow in coming.
Earlier this month, Monroe County's public health commissioner said the county has enough testing supplies to cover the first 6 to 8 weeks of school. We reached out for an update and have not yet heard back.
And to speed up training and testing for bus drivers to help ease the current shortage at school districts across the state, the Rochester School District says it will help fill 80 empty positions. And yet, as we hear from Jane Flash tonight, it won't address an immediate need.
Well, Don, every morning nearly dozens of drivers call in sick, and there are no substitutes to call in to replace them. In this videotaped message, Superintendent Dr. Leslie Myers-Small says more children have a ride than on the first day of school, and yet
the number of driver resignations and absences are still presenting a significant transportation challenge and are moderately to significantly delaying our route times.
The district says there's no indication drivers are calling in as part of a protest, yet managing absentee and sick drivers every day is the new part of this crisis. 25 vacancies as the week began on Monday.
That's about 50 uncovered routes that we have today, and that's just in morning or afternoon. They don't call in the night before, so you really are scrambling first thing in the morning.
Administrators, mechanics, and other support people in transportation all have commercial licenses and certifications, but tapping them to fill in means first runs are late. Schools already scheduled with a staggered second or third tier start time are even later, and there are delays for the ride home, too.
We have schools that go till 4 o'clock, and if you've got delays, especially in that third tier, then we have people staying a little longer.
Monroe County Clerk Jamie Romeo says her office administers the written test for the commercial or CDL license. She's already putting bus drivers at the head of the line. Now she's asking the governor to ease a requirement that these tests be given in person on state-issued computers at the DMV.
We can't administer those CDL tests without that state-issued equipment. So we're trying to explore those other ways, obviously in concert with the state, to make sure that as soon as these individuals and applicants are ready, they're able to get right through that process.
Now, New York State conducts the road portion of that test and is working to offer more dates for those and also to cut the mandatory waiting time between the application and the testing. It can take up to 6 weeks for a driver to be trained, licensed, and certified. This could cut that in half.